Good morning, everyone. Welcome to today's webinar on knowledge management. The topic selected for today is human capital. In last January, we present the report of the 2018 activities, including the collection and sharing of explicit knowledge. So now we are facing a different scenario. We are going to try to collect the most difficult part is the tacit knowledge, this part of knowledge that is not collected anywhere and we cannot share, therefore. Probably you are already familiar with this knowledge map. This is the knowledge of our network, of our ERN. This represents what is knowledge management in our network, why we work on knowledge management, who is participating, where is taking place this knowledge management, how we do it, and when. And we are going to talk about this part, the tacit knowledge, which is related to the human capital. We developed some tools of knowledge management in order to collect these knowledge courses. We did an expert course a couple of months ago that was very successful here in Madrid. And we try to collect this knowledge by interviews with these structured interviews that we perform with 4 participants of the board, storytelling, and 2-minute expert videos. These are the tools that we are going to use during this year. For those who are not very familiar, probably all of us are not very familiar with the human capital. We will have to go back to Adam Smith and this sort of theoretical things, but we are not going to talk about that. We are just going to be focused in healthcare. What does human capital means in healthcare organization? So it's an intangible asset. So you will not find in the report sheets of the companies of the hospital nothing talking about the human capital. The ACP can improve human capital by, like in companies, by investing in training and education and benefits for their employees. This part is more difficult, of course, in public health. And there's a strong relationship between, with economic growth for sustainability in the case of ACP's productivity and profitability. Finally, human capital can be depreciated also to long periods of inactivity and the inability to keep up with technology and innovation. And we can add to that sentence also education and training, of course. As I said before, there's a strong relationship between what they call tacit knowledge, the knowledge that is not available to share, and human capital, because people have this tacit knowledge. Is part of their personal background. The advantages of knowledge management taking care of human capital is that it will reduce the time it takes to do the task for any specific task regarding physician or not sanitary personnel in the hospital. It's very important to know how to do things, and you have to ask somebody or you have to find the information somewhere. It will improve the day one performance. This is very important for our nurses and the residents when they get into the hospital and they know nothing about how to do it in the hospital. And face-to-face interactions that are very typical, a very typical tool of human capital management are not enough because it just benefits one person. So if we are able to capture this knowledge, this tacit knowledge, and make it available for more people, we will succeed in the task. And it is impossible and not desirable to render all knowledge explicit. So we're not trying to capture everything, but just a small part of that. One very good example that I usually use in this presentation is this interview of Thomas Stalzer all of you are very well aware of who was Thomas Starzl, was the pioneer of transplantation. And this is an example of an structured interview, and this is what we want to do with the expert that we can find in our network. There is some conditions of this type of interviews that, but I think that people in the communication department in the hospitals are very familiar with these techniques. And we did, like I said before, 4 structured interviews in the last board in Madrid a couple of months ago. We also want people to 2-minute interviews. It's a very easy thing to do, and you can talk about anything you want. You can anything in your expertise area. Here, for example, we are showing a microsurgical technique in an experimental model, but you can talk about immunosuppression, rejection, psychosocial part of a transplantation, or anything you want. I'm not going to show all the video. So, and for those who think that that some areas are very difficult to summarize, I use this example of this presentation is about the if water become a right. So it's a very philosophical issue, and you can summarize it in 20 seconds. So we're not we don't want people to become like a blogger, but we can just learn the way they do the things to communicate the knowledge. So these are the tools that we are going to use in 2019 to try to capture this knowledge. And this is the chronograms. We are the first task we will be to identify mentors. So people that have been working for, I don't know, 13, 14 years in the field of transplantation, that is willing to talk to young people, to teach them, to guide them in their initiatives. We will want to identify at least 1 mentor for every center in the network. So it would be 18 mentors. It's not too much. This is going to be the first task. We are planning to finish that for September 19. So anyone that is willing to volunteer, they can do themselves, or they can be proposed by the HCPs. The second task is to identify human capital across the network. We will go back to the document that every HCP sent at the beginning of the ERN in 2017, and we will try to find this information in the document. In case we have doubts, we will go back, or we will contact you by email in order to have how many people do you have working, how many very expert people, the experience that they have, and we will identify not just the mentors, but the real experts in the network. And this should be finalized by October and December 2018. And finally, of course, it would be very useful to do the education and training program, because it's very useful if we can retain this knowledge and we use in our course. This is not about making very fancy videos and uploading to the website. This is very useful if we use with, as was mentioned before, with young nurses, young physicians started to work in the field of transplantation. So thank you very much. Okay. Any comments, questions? Any volunteer for the mentorship?